nice to be here with you today to talk about appreciating the past, recognizing the present, and anticipating the future. We're going to discuss what's happened in generations and how we can use the strengths of each generation of nursing to navigate and to shape the future in healthcare. What is appreciation? It's recognition. It's knowing an awareness of what's going on. Do we do enough of it? How did you feel the last time somebody recognized and appreciated for what you had done? One of the easiest appreciations and recognition is a thank you. No matter what language you're using, everyone feels and needs to be appreciated. When we look to the legacy of the past and celebrating it, who comes to mind? Florence Nightingale, the mother of modern nursing. What she did as a visionary and as a leader is really quite incredible. I'm sure most of the people in this audience have used her quotes and used her principles in thinking about their own practice. But as we now go to the silent generation, this picture tells it all. You can see those that were born before World War II or at the very end beginning of World War II really understood what it meant to have leadership, because leaders were in complete control in nursing education. There wasn't a lot of room for feedback from nursing students, but they did an incredible job. And then we come to the baby boomers. Oh my Lord, all born after World War II. They were well cared for because their parents were looking forward to ending the war and not having another depression. So baby boomers came into nursing, the majority trained in diploma programs. They understood hard work. When we think of baby boomers, we think of nurses who understand hard work and who had a sense of duty. Those are strengths to be used. And then we come to Generation X, born right before the Vietnam War, and they were born and known as the latchkey generation. Women had moved in great numbers in the workforce, and this was the first generation that were graduates of diploma programs, associate degree programs, and baccalaureate programs. So the workforce changed its face. And then Generation Y, those millennials, the millennials who are known for multitasking and who love technology, they brought strength. They also brought strength to nursing education and to nursing practice because they questioned all the rituals that had gone on before them. They have a different sense of purpose about patient care, but they work, as when you think about the workforce, you're talking about many generations that bring what they've grown up with to nursing. So it's a very rich environment. So what's happening with appreciation of nurses today? 2020 was named by the International Council of Nurses as the Year of the Nurse, celebrating the 200th anniversary of Florence Nightingale's birth. And 2020 and 2021 were declared by the World Health Organization as the Year of the Nurse and Midwife. So we know that there's global recognition of what nurses do. But what's ahead? How can we anticipate the future and use all the strengths from each generation? Leaders need to take responsibility to continue to empower nurses to use their voice to make a difference in patient care. Leaders also need to attend and address not only the physical and safety needs of nurses in the workforce, but the mental health needs. Think of all the things that nurses and others have witnessed during the pandemic in taking care of patients. There's been personal and professional sacrifice, and those need attention. So when I look to the future, and I want you to be part of the anticipation, advocacy is a #1 priority. Using your voice, your knowledge, and your skills to make sure that the concerns of patients and families are being addressed. So very important. And the second, well-being and self-care. Rarely do we talk about nurses and self-care. But if you don't have a sense of well-being, you won't be able to work to your full potential and make sure that the care of patients and families is as good as it can be. We have 2 inspiring thoughts. You have been assigned the mountain so you can show others it can be moved, beautifully aligned with advocacy. And the second, you were born to be real, not to be perfect. And this aligns beautifully with mental and physical well-being. I'd like to think that Eleanor Roosevelt brings us the insight that wraps all of this together. The future belongs to those who believe in the beauty of their dreams. Think about it. Appreciating the past, recognizing the present, and anticipating the future is all about believing in your dreams and working to make sure they come true. Thank you for letting me share my insights with you.